In this video, we are going to discuss some of the stretches and strengthening exercises for plantar fasciitis. Plantar fascia is a thick web-like ligament that connects your heel or calcaneal bone to the front of the foot. Plantar fasciitis is caused mainly because of the repetitive stress. Here are most common causes. All stretches are generally performed 20 seconds, couple of times on each side. While seated, wrap a pillowcase around your big toe and other toes and pull down the sheet towards you until a stretch is felt in your toes and around the bottom of your foot. Interlace your fingers around your toes and then try to stretch them down gently and then up, and with this movement you're stretching both the toe extensors and flexors. While sitting, use a yoga belt looped around your foot. Gently pull your ankle back until a stretch is felt along the back of the ankle. You can adjust your hands on the yoga belt. Make sure your foot is completely relaxed when you do this stretch. Hold the stretch as per your tolerance. Generally 20 to 30 seconds is a good start. This is similar stretch as before, except in this stretch you slightly bend your knee, so you are targeting soleus muscle, which is another calf muscle. Stand on a step holding onto the railing and make sure you are stable, and then the targeted foot you drop it down and feel the stretch in your calf. In sitting position, use a towel and draw it back towards you using your toes. Curl your toes first inwards and then push them out, spreading the towel away. Be sure to keep your heel in contact with the floor all the time. This is an excellent intrinsic muscle strengthening exercise. Similar exercise can be done by bringing the toes inwards and then outwards. In sitting position, write the alphabets in the air with your big toe. Your ankle should be moving as you perform this. Make sure the movement doesn't happen in your knee or hip joint. And with any of these exercises, if you have pain or discomfort, then please discontinue. In sitting or standing position, try to spread your toes apart. If you look at your toes, it's a little easy to perform, and make sure you're bearing some weight on your feet. Tennis ball roll is one of the self-manual therapy technique. You can even use frozen water bottle to do the same exercise. In sitting or standing, make sure you are supporting yourself in standing. Roll the tennis ball at the bottom of your foot with moderate pressure. Only use as much pressure as you can tolerate. And please discontinue this exercise if you have any pain or discomfort, and consult your physical therapist. In manual therapy, with trigger point therapy and myofascial release, I have found it helps a lot with plantar fasciitis pain. Trigger points are those small muscle spasms, muscle knots that form in the region, and with ischemic compression we call it, or giving a sustained pressure, we release them. Funny part is, lot of times what I have found is trigger points are present in your calf. You feel it, Jay?
Yes, I do. It's very tight.
Yeah. So right now I felt one right here. And automatically I do side by side myofascial release, because it just goes hand in hand with trigger point therapy. What happens again? You have a pain in your plantar fascia. You may have trigger points in your, oh, right there. You feel it?
Yeah.
Trigger points. It's just not in one side. And that can go from your quadriceps, your hamstrings, your gluteus, and your back. In my observation, plantar fasciitis is never a singular problem. Lot of times there is a biomechanical issue in your hip, knee, even your back or spine, where there is muscle imbalance. Some muscles are tight, some are weak. How patient walks is also very important. If there is a need of different footwear, we have to assess it. So it's really important to go to your therapist and get proper assessment and treatment for plantar fasciitis. You want it to be a lifelong resolution and not just a one time thing. And also it's important, like a lot of times I hear, oh, I wear inserts and then I am okay. But inserts are great in acute conditions, but you don't want to depend on them. They should not be your crutches, especially if you can avoid it. So please don't wait, go to your therapist and check things out. Thanks from me and from Leverage Physical Therapy.